2024 Telstra Best of Business Award, National Championing Health Award is EARWAX.
Wow, thank you. Has anyone here ever had a blocked ear? If you have, this is a win for all of you, trust me. Thank you to all our wonderful EARWAX nurses, our whole head office team, and our patients who trust us with their precious ears every day.
My name's Lisa Hellwege. I'm Clinical Director and founder of EARWAX, which is a nurse-led professional earwax removal service. I graduated from the University of Tasmania in 1994 and I began working in hospitals. I then worked for a pharmaceutical company for a long time. I worked in infection control and eventually I ended up in ENT, or ear, nose and throat. And that was my specialty for 2 or 3 years. When I used to see the specialists work in clinic, I loved that they were building on their knowledge all the time, getting better and better at what they did all the time. And I thought that moving into specialising was the way to be able to work more autonomously, and that was where the idea of EARWAX was born. EARWAX is a professional earwax removal service. It's nurse-led, and we remove earwax using a special procedure called microsuction. You have to be specially trained to perform this procedure. I started EARWAX because I used to work in the ear, nose and throat field. I saw the procedure being performed at work and I wanted to make sure that my local community here in Hobart had the opportunity of accessing such a safe and gentle procedure.
EARWAX is a shining example of registered nurses that are trained and who understand their scope, taking pressure off GPs and emergency departments across the country. We're going to spend the next 12 months raising awareness of what registered nurses can do to assist the Australian healthcare system and the issues that it faces.
If you find a gap in clinical care, there's a number of ways that you can go about it. If you're looking at making an improvement in your workplace, that's one way that you could look at it. For myself, when I saw that gap in the market, I chose to navigate and deal with that gap through business. So for myself, it was working out what the gap was, what the market need was for the gap, getting really clear on what kind of service that we could put together to address that gap, and then basically putting together a business plan which includes, looking at what's the need for the service in the community, how are you going to market your business, how are you going to budget for the first year or two in your business, because you really need to make sure that you've got enough backing behind you to make sure that clinic's going to be sustainable in the first couple of years. I started EARWAX 9 years ago, 4 hours a week. So I was still part-time in my role at the Royal Hobart Hospital. So I was carrying 3 phones at the time: my infection control for hospital redevelopment phone, my EARWAX phone, and my personal phone. And sometimes the EARWAX phone in those early days started ringing when I was at work, and I'd have to quietly answer like this at my desk, book people in. Sometimes I was ducking up in my lunch hour to see patients. Eventually I realised that wasn't sustainable, so I moved across full-time to EARWAX. So starting a full-time nurse-led business was really breaking a mould. I was very fortunate in that I had the support of my husband and the specialists I used to work with, and I was able to rally the community and referrers, I managed to get moving on my business. But then there's always challenges with business. You don't know really whether it's going to work until you actually do it. We had COVID to deal with. That was very tricky. Fortunately, we were considered an essential service, but a lot of our elderly patients were reluctant to come out and visit. So that was very tricky for a while. We've also had the challenge of the regulatory environment, the funding bodies not keeping up with the regulatory environment. So we have a regulatory environment that allows for nurses, we're trained and competent to work within their scope of practice, but where the funding bodies like Medicare and private health aren't keeping up. And so we had that challenge. We've been a fee-for-service business right from the beginning with no support from any funding bodies. When we received the Telstra Best of Business Award for championing health, it was fantastic. It was just the best thing. It helped to reinforce our already good reputation, but it helped with our branding. The process itself taught us a lot about our business. So we were really put through the ringer in terms of our application. There were huge applications, a lot of rigour around the process, a lot of submissions that we had to do. So, and then at the very end, we had to do a 10-minute presentation in front of 3 very esteemed judges, which was very nerve-wracking. But the outcome was we just couldn't believe it. We were so stoked.